to the next slide. Perfect. And just two more. Yeah. Cool. Out of the way of that. Hi everyone. So I'm Chris. I work for the Cancer Alliance, and today we're learning about lung screening and a few other things as well. To make sure we're using the best of your time, I really want to make sure that you give any feedback you can to us about what you feel you'd like to learn in the future, maybe things we've missed, what we've done well. So we're trying to gather all that information on this QR code. So on your chairs, you will either have a questionnaire or you can use the QR code. I'd prefer if you use the QR code, but if you don't want to do that, that's cool. Use pen and paper. Answer just the first question about your kind of experience about what you know about lung cancer. Little tick box. Then after we've done the presentation, you can ask, again, we'll ask the same question. How do you feel afterwards? Do you feel more informed? If you do, please let us know. And there's a few more questions. So for the moment, if you can just ask the first question, and then we can ask some more later in the session. But thank you, guys. I think you both?
Yeah. Hi, everyone. My name is Vicky. I also work for the Cancer Alliance on lung cancer screening, which is why we're here today, to let you know about lung cancer screening. And just very interested, as a show of hands first, who, before they came today, had heard of lung cancer screening? Oh, good. Excellent. Good. All right. So we're good. We're just going to walk you through what's involved, and we're going to encourage you to recommend to come forward for your lung cancer screening if you haven't already, or to recommend a friend or family to come forward. Just starting on, so what is lung cancer? So it's the third most common cancer in the UK, and it's the most common cause of death. And the reason for that is symptoms don't often show up in lung cancer very early. So it's typically diagnosed when it's quite a late stage. So it can affect one lung or both lungs or the windpipe. And smoking is still the biggest risk factor for lung cancer. So 79% of lung cancers are diagnosed because of smoking. And as a result of that, it's considered to be preventable disease. It's important to obviously diagnose lung cancer quickly. So if it's diagnosed in an early stage, it's much more treatable. So as I said, often you don't have symptoms of lung cancer. It will be growing, and that's why lung cancer screening has been launched. You've got a question there. Very happy to answer.
Including smoking, does that include vaping?
There needs to be, I think, as vaping is relatively new, there's not enough research in vaping as of yet. But if you have a nicotine-based vape, you would be considered a smoker. So yeah, we do count that, and other nicotine products as well are considered. You're considered to be a smoker. But in terms of long-term effects and lung cancer with smoking vapes, there's unfortunately not enough research on it because it's relatively new difference.
So someone who vapes a nicotine-based vape and is over 55 would be eligible.
Will be eligible. Yeah, exactly. Yep. So just moving on. So what are the signs that we've added the signs and symptoms here, but it's reason why we have lung cancer screening is so we find them before you have signs and symptoms. But just to let you know what the signs and symptoms are for lung cancer. So coughing up blood, these are all signs that you should definitely go and see your GP as soon as possible. A cough that lasts more than 3 weeks, or a chest infection that won't go away. New or unexplained shortness of breath, very short breath, and there is a breath score that you can do. I can share with that later to establish what your shortness of breath is like. Weight loss or appetite changes if you notice a reduction in weight for no explained reason. Fatigue, pain in the chest, ribs, shoulders, or shoulder blades, or spine, and sometimes other symptoms which aren't really that typical would be a hoarse voice for more than 3 weeks, finger clubbing, which is actually quite rare. So with all of these things, your GP would be concerned if you've got at least 2 of those symptoms. But if you're over 55 and you're a smoker, they would consider further tests for if you've got any of those symptoms that have been unexplained, so you weren't expecting them. It's basically where the nail becomes really large in the fingers. So the tips of your fingers are quite narrow, and if they become very wide, you can have a look at pictures of it. It is very unusual. It's sometimes found, but yeah, it's not typical. Moving on. So just some stats around lung cancer and why we really focus the screening program is really important. So about 49,000 new lung cancers are diagnosed every year in the UK, which is more than 130 cases each day across the UK. As I said, lung cancer is the 3rd most common cancer in the UK, and it accounts for about 13% of all new cancer types. So it's a significant cancer. It's the leading cause of death, cancer death in England and Wales, because it's diagnosed at quite a late stage. Only 11% of people survive lung cancer for 10 years or more at the moment, because it's diagnosed at a late stage when it's often not treatable. But we'll explain the difference of lung cancer and the importance of diagnosing earlier and the effect of that in survival a bit later. So an estimated 79% of lung cancer cases are preventable. So this is linked to smoking. So if you are a smoker, you are putting yourself at more risk of lung cancer. Improvements in early stage diagnosis due to targeting screening programs. The NHS are one of their big targets over the next 10 years is really to help disease being diagnosed earlier, particularly in cancer. And this screening program really does help to do that, like other screening programs as well. Bowel, breast, cervical cancer are all really important. So it's important you get checked before anything happens. Next slide. Okay, so some stats around the lung cancer screening across the UK. So since the program launched in 2019, and it launches sort of in certain areas, and then we're rolling out across. We're trying to invite everyone in the UK at the moment. So up to date, we've invited 3 million people across the UK, and I think 1.6 million people have attended their lung health check, and we've diagnosed over 10,000 lung cancers. 75% of those are early stage. So these are people that, had they not gone through the screening program, would have found symptoms and been diagnosed and gone to hospital at a later stage. These 75% of those patients would have had had treatment like surgery and come away cancer-free. So we launched in South East London, so we cover 6 different boroughs. We launched in Southwark first, then we rolled out to Greenwich, and then we've been in Lambeth and Lewisham the last year. We should finish all of Lambeth, inviting everyone in Lambeth later on this year. So we've invited over 90,000 residents across South East London. 25,000 have attended their lung health check, and we've diagnosed 100, I think that's 150 now actually. So we're at 150 lung cancers have been diagnosed. 75% of those have been early stage. And Elaine's very kindly joined today, who is a patient that's gone through the lung health check, and we can share some of her experiences of it. So that, yeah, another question. Thank you for questions.
What are your criteria for inviting people to be screened?
Yeah, so if you're 55 to 74 years old and you've ever smoked in your lifetime, which means more than 100 cigarettes in your lifetime, you will be invited. So we can explain the process in a little bit more detail in the next few slides, exactly how it works. Yeah. Is that the next slide? Thank you. Well, he's going to take over to explain exactly what happens.
I have to wear this. Ooh. Maybe I'll hold both. Hi everyone, I'm Holly. So I'll just jump straight in on who is eligible. So if you live at one of these 6 boroughs, as Vicky's just said, you would be eligible as we roll out through the programme. You're eligible if you're aged 55 to 74 and you're registered with a GP within one of these boroughs in South East London. You either currently smoke or you used to smoke, and this will include occasional or social smoking. So we don't just invite those who are heavy smokers. How would we know? Eligibility is based on information that you have given your GP. So if you've ever told your GP that you smoke, we can see that and we would extract that data and we would invite you. And what we invite you to is for a telephone risk assessment, and that's just to learn more about your smoking history. As Vicky's just said, we're currently live in Southwark, Greenwich, Lambeth and Lewisham, and we will roll out to Bromley and Bexley later this year. You can check our eligibility calculator online, or I'll be sat over there at the break. You can come over and we can have a look together. What it does is, I think if you click again, Chris, it's just a little banner like this on our website. And it just starts going through the questions of those bullet points. So it will ask your age, who your GP is, and whether you currently smoke or used to smoke or you've never smoked. And if your GP has gone live, if we're starting to invite in that area, it will say that you are able to attend a lung cancer screening appointment. Hopefully you've already been invited at that point and you've already had your letter. Next slide, please. So how does it work going through the lung cancer screening programme? As I said, you'll have a telephone risk assessment, and this is with one of our very friendly staff members. They'll ask you a few questions about your general health and your smoking history. It's very quick. I think it's about 10 minutes from picking up the phone to finishing the phone call, and it's completely confidential. Based on those answers that you give the health professional, they'll assess your risk of developing lung cancer. And there's only kind of two outcomes that will happen from that telephone risk assessment. So you'll either be low risk and you don't need any further checks, and we will invite you again in a couple of years' time. You'll also get a letter confirming that. Or if you're high risk, you'll be invited for a low-dose CT scan, and that's to take a bit of a closer look at your lungs. The CT scan is super quick. It's 30 seconds in the actual scanner. It takes place locally. We are usually in supermarkets. So at the minute we're in, where are we? Dog Kennel Lane in Sainsbury's. You might have seen us. It's very painless. It's very easy. And then you'll receive a letter with your results. But in some cases, a nurse may call you and talk through if they found anything. It doesn't always mean that we found anything sinister, but it may mean that we need to have another closer look. We obviously offer interpretation and translation all the way through. We have this nice leaflet here, over here, if you want to take one today. Next slide. So what happens during the scan? Has anyone had a CT scan before? Anyone in the room? Yeah, a couple, lovely. So it's one of these machines here, quite big. They look like big donuts. And the scan itself will take about 30 seconds. You'll lie down in a bed, and that will move through the scanner. So you don't need to do anything, you just need to lie still. It's completely painless. We don't have any injections. It's really low dose radiation, so we don't need to give you anything to see inside the lungs. There's no prep. You can eat and drink as normal. You can wear your normal clothes. There's no requirements to have that CT scan. The only thing we might ask is to remove any jewellery you might be wearing or any kind of metal items. Our staff will be on hand. So we have a healthcare professional in the, we call it a unit, so the CT scans within a big unit. And you'll be treated with respect and care throughout. After the scan, you won't get results on the day, but like I said, you will receive a letter or a phone call from a nurse with your results. This is one of our friendly nurses here at Lambeth County Fair last year. Next scan. So this is our advert. So you might have seen this. We're actually launching on TV now this week. So you might see this on your TVs. We also have posters around and big ad shows. But it just gives an overview of the programme and why it's so important to attend. It should play loudly.
It's important you don't miss your NHS lung cancer screening appointment, even if you have no symptoms. Because if there's a problem, it's easier to treat if it's found early. Don't be missed. So South East London lung cancer screening.
Lovely.
Every day, 90 seconds.
So I think we're going to a break next, but we are over there. I'm happy to take any questions right now, or if you will, yeah, lovely.
I just wonder sometimes what happens if you're over 74?
Yeah, so it depends when you're invited. So if you're over 74 right now, we wouldn't invite you, and we would ask that you look for your signs and symptoms that Vicky went through earlier and go and speak to your GP if you have any concerns. That is always a moving fleet. So it's the same with any kind of screening program. There is a cutoff point, but yes, go on.
So for completeness purposes, do you have, as part of your campaign, providing GPs with material for people that are under 55 and over 74, so that although they're not going to be eligible for the screening, it will tell them
what to do next?
Yes.
Absolutely, yeah. So we have part of this campaign. We have also like big booklets. There's some over there, but they are also available for GPs around the program. But also, if someone isn't eligible, a lot of people ask us lots of questions around they haven't smoked, but they have been in passive smoking. In households, they live in certain various pollutions. All of those, that criteria right now wouldn't make you eligible, but there is advice that we give GPs. Any more questions? Yeah.
I was just wondering how soon after the CT scan do you get your results?
It usually around 2 weeks, maybe a little bit sooner, but we do normally say 2 weeks.
Yeah, you would get a call sooner if there was something, if there was more tests that would be needed, so it tends to be a priority for
Any more questions? No? Lovely. We're over there if anyone wants to come see us, or if you want to check if you're eligible, yeah?
Yesterday can have lung cancer and you never smoke. So hold that.
That is correct, yeah. So the screening program only applies to those who have ever smoked. But if you haven't and you see signs and symptoms, we would recommend you go see your GP.
So now it's just as extreme with the short lung cancer.
So it's a CT scan that we look with. Sometimes it does show on an X-ray, but CT would be gold standard, which is why we offer that one.
Yeah, one of the things that we've got, the CT is much more sophisticated imaging. So, we use some software to size what are called nodules that are potentially early stage. So the CT is the gold standard for finding out. But a chest X-ray would often the GP is the first point of call. They'll offer you a chest X-ray.
Is the CT MRI or is it different?
It's just CT. Yeah, CT.
Yeah, MRI is different.
Yeah.
I think people often worry about the CT because the MRI is the sort of machine that you're enclosed in on. Yeah, but yeah, I think so. Yeah, the
MRI,
CT just literally moves, the sort of donut moves across your chest, basically. So it doesn't cover you in.
Okay.
All right, lovely. We're over there if anyone wants to come talk to us or you want to check your eligibility.
Thank you so much. Okay, we're going to take a 5-minute break, so feel free to stretch your legs in the lovely sunshine or get some refreshments at the back. We'll be back in 5 minutes.
Thank you so much.
Yes, absolutely. Yes, exactly. Let me have that. You obviously don't look over 21, so I have to ask.
Yes, I am.
No, I can look up your GP at the moment. Just to see if you can find it. GP is being applied, so you have so just your GP practice. Yes, yeah.
We're meeting up for. We're meeting up about breast screening. So I've spoke to the service, and they're happy. So I will have a meeting with you guys, supporting. I'm not going to be present, but Charlie will be there. And we'll talk about
I need to check with them. I hope I do back by then.
We double check.
I'll double check. I'm sorry. I'll double check.
It's okay. It's fixable. Whatever, but we'll make it work.
I'll double check. Vicky.
Where are you going?
I'm not going anywhere.
Oh,
Tell me.
Okay.
I'm here. Because the next day, I think Teddy will be around. But 2 days after the election,
Yeah.
we have the next election.
What's the next one?
It's on nutrition. As it relates to metabolic health conditions, like disease, hypertension, and all that. So I have someone who's come to talk about to cook. Not really how to cook, but choices of vegetables. What would be suitable in terms of what vegetables high blood pressure, diabetes,
Do you see like common dietary issues, like people? Is it like processed foods? Is it like oily foods? What do you see?
We just have some people who don't just cook. They only they are high on processed foods. Mainly because of affordability and time.
It's so cheap, isn't it? Yes. It's really calorically dense, cheap, it's everywhere, you can freeze it. My younger sister is a bit like that. Like, you can get out of the freezer, it's in the oven, it's done. She's got a little kid. Cool. That sounds interesting. Who is the speaker for that? Are you getting the dietitian to be the speaker for that section?
Yeah. We have an MD dietitian.
Okay.
So a nutritionist who is a medical doctor.
What other workshops do you have?
Anything basically.
Anything else?
Anything health, exercise, general health. Yeah, we'll begin to add that now in finances because some of our services they need to know where to access those schools. So because we work with the council, we will have help and support from them. Dion is here, so she's on the bus. So we already have people who come once or twice in a month to do the financial and housing talk. So we always signpost.
Cool. We were talking about this recently. People are going through a lot at the moment. Everything's so expensive, services are getting worse, and it should be a focus, especially in hospitals. But if you get someone gets ill, they don't know like, what they're entitled to. Like, I think it's a
We're expanding, right?
We're expanding. Yeah. All good. It's really nice. It's nice people get engaged as well. It's good. It's a nice group of people.
Don't worry, they haven't started asking the questions. Sorry, you need a pen?
Yeah, my brain is still thinking about what she said. Someone took it to you. I can hear the no, but they heard me when I said one person. They had 7 people at one point. She said to You want to say in 30 seconds? I went to another war.
Your best side?
I like cameras.
Ah, nice. And I'm sure the camera loves you back.
I don't know about that.
All right, so I'll hand this over to you in a minute. I'm just going to introduce you. So remind me your name again.
Elaine.
Elaine.
All right, everyone. Are we happy?
Yes.
Are we fed?
Yes.
Are we watered?
Yes.
Are we enjoying the sunshine?
Yes.
Okay, I'm going to get back at it now. I'm going to introduce Elaine, who is going to talk on a lived experience. So if you give her a round of applause.
I don't know about that. Thank you.
Over to you, Elaine.
So why the 2 mics? One to film me, one to talk. Okay. My name's Elaine. let's see, I got a phone call from a nurse for what I understood to be a lung health check. She called me and she said, had you smoked before? We went through a few things. I think I became what they call a good candidate for the test. At the time, there was the CT scan at Asda on the Old Kent Road. I lived just a few blocks away from Asda. So that worked out really well. And I was invited to the scan. I went in, had a bit of a chat, and then got inside the so-called donut. I think, I'm going to say this was the beginning of June, so of 2023. Then I had the scan and I think I was told at the time it would be like maybe 6 weeks before I heard, I don't know, about 2. But within less than 2 weeks, I got a phone call from a nurse saying that, we've seen something and we'd like you to go to Guy's Cancer Centre. I was like, right, okay. I think that means something. So I went along and met a doctor, and he showed me on a screen a very small nodule. It wasn't confirmed that that was 100% cancer. That was, could have been, might be benign, could be. So they do something called a lung biopsy. Now that's where my problem started really, because by the time the gentleman had finished explaining to me what might go wrong, my blood pressure went up. And they call that white coat syndrome. So it took a couple of weeks for me to have the actual biopsy. From what I can gather now, the NHS are looking into maybe putting you out, which would have been better for me because, I guess I got quite kind of nervous at that. I had the biopsy. After that, it was discovered that it was, in fact, a cancer. Very lucky, it was stage 1. And then I met a surgeon who explained to me about possible radiotherapy. But if I'm honest, in 2013, I had throat cancer. So I'd had 4 weeks of radical radiotherapy. 10 years on, 2023, I have the beginnings of a lung cancer. I'd smoked years ago, but I'd stopped for quite a while. I thought enough, but obviously not. So I decided to elect for the surgery. Now, there were 2 possibilities. There was something called video-assisted thoracic surgery or robotic-assisted thoracic surgery. The surgeon gave me video-assisted thoracic surgery. And what it was like, it's like keyhole, because a few years before that, a friend of mine had been sort of cut from front to back because that's the way they did things before now. So the 3-pronged thing went in and pulled the cancer out. There's 3 lobes on your right side, and it was on my middle lobe, okay, rather than the upper or lower. So they took that lobe out, and I woke up, very good, and then the next day I was putting my rollers in my hair. So they said to me, oh, you're doing pretty well, so we're going to send you to another floor, because I was on the 10th floor of Guy's, where everyone was having this sort of procedure and that type of thing. And then they put me in a different place, which was fine. And then the next day I went home. And 10 weeks later, I went back to work. And I worked full-time at Waterloo Station as a customer service assistant on London Underground. So that was pretty quick timing. And that basically is my story. Any questions? Don't know if there's anything you want to ask me. Ask me, yeah.
I want to ask you, how did the surgeon did the biopsy?
Oh, well, the biopsy wasn't done by the surgeon. The biopsy was done separately. You have to go in where they do biopsies, basically. The thing was, it was a bit, I don't know, they were going to put a needle in and take some samples, and that was fine. But when he started to tell me, oh, this could go wrong and that could, because, you know, you got a sign. I'm like, what? I don't know. So I think now if they start to do it where they put you out, it probably makes more sense. Although some people probably would have no problem with that. I mean, when it happened and the biopsy came, once I got to it, it was fine. But I spent 8 days in the hospital trying to bring my blood pressure down, you know, but that's me anyway, always causing trouble. So that's how that went. But the biopsy itself, it showed that it was in fact a malignant cancer. But like I say, it was stage 1. It was very, very small. I was very, very lucky. And that all came because of the lung health check. There's no doubt about it. I would have just carried on, not thought about anything. I wasn't ill. There was nothing wrong with me as far as I was concerned. But, you know, that's how that worked.
How long had you smoked for? And
I think, I'm going to say I probably started, you know, when I smoked, everybody smoked. I'm 68, I'm 69 in May. You would smoke in offices. Everybody was smoking everywhere. Do you know what I'm saying? They would advertise, oh, you know, do this and you'll meet somebody or whatever. You know what I'm saying? All the movies and all that type of thing. So it wasn't wrong to smoke when I started smoking. But I'm going to say probably 20. I stopped when I was 39. I had my first child. And then smoked again and then stopped at 42. I had my second son. And then I think after that pretty much, because my uncle got lung cancer and passed away from it, had a very bad cold he couldn't get rid of. But of course we were way down the wire then. That was in 1999. He died in 2000. So after that, I completely stopped smoking. I haven't smoked in 20 whatever years it is, 28 years. But I think I'm one of those people who should probably have never smoked. Do you know what I'm saying? I don't know. You know what I'm saying? Nowadays, none of my boys don't smoke. And most young people aren't doing that anymore. But when we were young, you were sort of, that was something you did. You know, you thought you were really cool.
Now, after they done the operation,
Yeah.
no medication, no checks after.
Checks.
Just went on.
Yeah, life went on, but checks every 6 months. I go back to Guy's Cancer Center and I have like a blue dye put inside so they're able to see if it's come back. I'm checked for 5 years and every 6 months I have this blue dye so they can actually see. It's another CAT scan basically. Have CAT scans every 6 months to make sure it's not back when it isn't. So we're cool. Well, I don't know. I didn't really have a lot of pain. I don't remember taking anything particularly. Obviously where the site is, because I had like three little slits. There's one under the arm, one towards my back, because I think it's like a prong thing and it goes in and pulls it out, sort of thing. So a little bit, and sometimes it aches a little bit now. Now you've mentioned it, started to ache, but generally no problem. Anything else, guys? No? Good.
Yeah, I think that's the thing that people think about lung surgery. Actually, it sounds a lot, doesn't it? But you know,
yeah, but it's
Elaine was overnight in the hospital and then able to recover after that. So I think that's the big difference and change that we see in patients that come forward on screening. I was just going to ask one question. Was there anything where if you received the letter in the post, would you have always have done it, or was there? Oh yeah, but that's I guess for me quite important. I mean, at my age first, I think we sort of got a bowel test, and there's always mammograms, aren't there, over the years. And I think for me, anything that's offered, I'm the sort of person who will take. I lived in America for a number of years, and believe me, nothing's free. So if you get the opportunity to go and have some sort of screening, you're ahead of the game because you'd have to pay for it in the States. So anything that was offered, I would take. And I think anybody,
you know, that's offered anything in terms of screening, because the thing about cancer is the earlier you get it, the more chance you've got of hanging out. And I've got a 29-year-old and a 26-year-old son. They should be my grandchildren, but they're my children. And I intend to stay around. So if there's any way that there's anything I could do to lengthen my life, I'm on it. Okay.
Hi everyone. So we are at the Q&A section now. This is the opportunity where you can ask questions. We have GPs available in the house here. So ask questions. We want you to ask questions related to the cancer screening.
I want to take them on pictures of
Any other things that you need clarity on. So who's going to go first?
Sorry, I just wanted to clarify, you probably said earlier, but I can't remember. So people are automatically invited if it's on their GP record that
Yeah.
they smoked. If they haven't told their GP that they smoked, can we go on and change the record so that they can get invited, or can they just opt in?
Yeah, so what we're going to do moving forward is that we're going to encourage people, remind people to update their smoking record at their GP practice, because at this point in time, that's how we find that you've been a never smoker. So, but what we can do in the service, if you live within our area and have you're the right age group and you've smoked, but you haven't told your GP, you are able to access the service that way, and we'll just let your GP know. So I think sometimes people don't want to tell their GP that they've smoked, so we completely understand that.
What about if you worked in a pub for a considerable amount of time and then smoking was all around, like I had to be fanning?
Yeah.
Or so can you just leave your bag over there, please? Let's get all offended, but it was right down my throat, so
Yeah.
you know, would I be considered to have a screening done?
So passive smoking is not something that's offered as lung screening at the moment, but it is talked about. I think as lung cancer screening, the majority of those have been active smokers, not passive smokers. So the stat that I showed of people with lung cancer, and yeah, I think as smoking drops off, because smoking cigarettes has stopped and is generally falling off, that we'll see a change in the amount of lung cancers, and there could be environmental factors as well as passive smoking that affects. We do, as part of South East London, have a community group which is led by GP that looks at other risk factors for smoking, like environmental factors or passive smoking. There's, as I said, similar to the vapes, there's just not enough research around it at the moment. But I think the NHS are trying to tackle the highest risk population, which is people that have smoked first.
So say someone's mum goes into screening because they're eligible and has a diagnosis, and her children have grown up in a smoking household, are they eligible at all, or is no passive smoking?
No passive smoking at all at the moment, yeah. Just because the statistics are so much higher for people that have actively smoked. And there is something about putting those chemicals through your body actively that is more high risk than taking it through others passively.
Well, you know, they said stop smoking, but they sell cigarettes. They said stop drinking, but they sell spirit. Somebody gonna do it. Yeah?
Yeah, I mean, alcohol and cigarettes wouldn't be invented now, you know, they've known about it. But yeah, definitely, they're very highly taxed, both of those now, which is a good thing. Which making it expensive, but that doesn't mean to say make it expensive. It's highly addictive. I think what we didn't say is that we do offer smoking cessation advice for anyone that's struggling with smoking. So that is part of the service. We have a smoking cessation advisor on board that can give you help to stop. I think the average amount of attempts it takes to stop smoking is around 4 or 5 attempts. So we fully understand how difficult it is.
Yeah, I think people, like as it says in Asia, remember Roy Castle.
Yeah.
He was an example.
Yeah.
Because he worked.
Yeah.
Around people that smoke.
Yeah.
Acid smoking.
Yeah. So Roy Castle, so the lung cancer screening, Roy Castle charity were responsible for getting lung cancer screening through the statute, so through law and through the screening committee. So they've lobbied for it for years, but I think it's because the statistics are so higher for smokers, and it is quite an expensive screening program, and that all your taxpayer money is going towards this, that there has to be a priority in the end, which is similar to the age criteria. But it tends to be clinically driven, and the clinical evidence proves that if you've been an active smoker, you're much more high risk. There is quite a bit of work on genomics, which is around the family history, so your potential, and there's a lot of work in breast, not enough research yet in other cancers, but it is developing, and I think that we'll see a real growth in that area. So if you've got a familial part in your DNA, which makes you higher propensity, which Elaine you might have had with your uncle. So that's one of the questions that we ask in the lung health check, which will make you higher risk if you've got a family history of cancer.
I know someone that smokes and tell the doctor that you never smoke and was still smoking.
Yeah. Yeah.
The doctor said, "Did you smoke?" He said no. But he was smoke. What is that?
Yeah.
He said that's not none of the doctor's business.
There's a lot of and there's a lot of shame around smoking and potentially lung cancer that we find, because people know that potentially it's very addictive. Tobacco, we know, so people struggle being able to stop smoking and don't want to talk about it. And often we find a certain group of people, particularly men over 55, that might struggle to come to screening anyway, will be particularly might find it difficult to have that conversation.
And I just stopped just like that, without any,
no help,
No help. I just said I'm not gonna smoke again, and that was what it.
Yeah.
I think the day when I stopped, did sometimes have a no smoking day? Yeah, was a no smoking day, and that's the day I said I'm not gonna smoke again, and I didn't another cigarette in my mouth.
It's a mindset, isn't it? But yeah, a lot of people go back and forward to it till they completely quit. Great, thank you.
Yeah.
You're late.
I'm coming.
You're late. You're not late. Before, you would never get lung cancer. No.
What's the question? I didn't hear it, sorry.
So you never searched for before.
No, you do. There is, very often a lot of this work is clinically based, and it is on probability. So obviously, there's always cases that might say something different. So you could get lung cancer if you've never smoked before, and that could be due to what we've said: passive smoking, environmental factors. Especially living in a city, you're exposed to lots of things, but also a familial history. So if you do have a family history of cancer, that could be there's a lot of research around at the moment on cancer genes, and I think that will really develop over the next few years. I don't know if that answers. But yeah, that's why we really encourage people to think about their signs and symptoms. Any concerning things, go speak to your GP about it.
I've got one more question.
My question is, I don't understand, most of this screening is offered to people of certain age, and once you pass 70, it looks like, yeah.
Yeah.
So it's a very difficult to take it all on board.
Yeah, my mum said that to me the other day, actually, she's 86. But I think whilst we talked about lung surgery is great and it can be really successful, and there's a certain age where we talk about this a lot, and I think this is something that we're as the lung screening community, we really want to see a difference. Because even though age is given as the criteria, someone who's 75 could be healthier than someone who's 55. So I think age is sometimes not that helpful. But the reason that it's got a cut-off is the average age for lung cancer at the moment is 74 years old. So that's why there's that cut-off for it. And also having treatment potentially in your late 70s or early 80s is more problematic. So yeah, we would like to see, we would like to see older people offered it and younger people, but at this point in time, the criteria is set and we go with that.
Thank you.
What are we doing? 54. So once every 2 years we go back to the GP practice, and if you're 55, if you become 55 in that time, we'll then invite you. But at the moment, we're just trying to invite everyone in that age group. There's about 190,000 people that we've got to invite over the next couple of years. So we're pretty. We've invited pretty much. We've invited about 60% of our population now. So we're just getting through that. But you're most likely to be low risk when you're 55, if that makes sense. So we like to make sure over time, especially if you're still smoking, that we re-risk for you regularly.
What kind of treatment if someone has got lung cancer? I know she said chemo. What else is there available?
Yeah, so there's the options are the gold standard is surgery, and that's not always possible. Sometimes you can have needing chemo and surgery after your surgery, but radiotherapy, chemo are the other ones. So you'll have treatment with curative intent, or have treatment that's palliative care, and that's when it's late stage, and possibly that's just to manage your symptoms rather than for curative reasons. But those largely are the three. There's different types of radiotherapy depending on the cancer type.
Thank
you. Okay. But we're going to do some myth busting
now.
Hi everyone. So just before we move into the next activity, I just wanted to give the mic to program lead to say something.
I need both, do I? Which one? Both. Oh wow. I've got both today, even though I walked in late. Thank you. It's wonderful to see so many of you here. And it's lovely to see familiar faces as well. And I think that the thing that we're trying to do with this community initiative is to recognize that each and every one of you here is a neighborhood ambassador for your community. So even if you feel this doesn't relate to me, I don't have any risk factors, I'm not in the age group for screening, your mere presence here is so important, because we want you to take this message back to your families, back to your communities, back to your mosques, your synagogues, your churches, wherever you are, in the barbershop. Just help people to know that this service is available for them, it's free, and they can go and get checked and catch things early. So thank you so much for being here, and please do take this message back. And if you are invited, as a GP, I know it's so critical that it's important that you take up these invitations and prolong your life and really enrich your families and communities. Thank you very much.
Thank you. Are we ready for myth busting? Yep. We got cards. Lovely. Cards are coming out. So we're just going to do a few questions, nice and interactive. And if you think the question is, the answer is yes, or that it's true, it's a green card. If you think the answer is no, or that it's not true, it's red. I hope that's simple enough. But give me a shout if it's not. I'll let them be handed out. There's no cheating in this game. Everyone gets a fair chance. So, first question's up on the screen, just whilst we wait for those to get handed out. I stopped smoking ages ago, and now I only vape. I don't need a lung cancer screening appointment. Lovely.
How old is this person?
There's no context. Whatever the question is, you could be eligible. All right. I think the majority have got their thumbs up. Go to the next slide, Chris. So that was false. You still have a higher risk of lung cancer than someone who has never smoked. Screening can find lung cancer early when they are more treatable. So even if you stopped smoking ages and ages ago, years ago, we would still like to invite you, we would still like to come forward. All right, next question. Lung cancer screening is only for patients with symptoms like a cough. Oh my gosh, look at this. I think you've all got it right. Lovely. That is false. Lung cancer often has no symptoms in the early stages. Even if you feel fine, it's important that you attend your lung health check. Lovely. Next question. If I go for a lung cancer screening appointment, the staff will talk to me about quitting smoking, and I don't want to. Curveball. Don't think we spoke about it. Okay, shall I do a countdown? 3, 2, lovely. That is true. Well done. We offer a judgment-free service, but we do want to give you support if you would like to stop smoking. If you don't want to stop smoking, we won't be forcing anyone to go and talk to the smoking teams in your local area, but we would encourage you to do so. It doesn't mean you go ahead for the lung screening or not, based on if you take up that offer. It's just something that we do offer as part of the programme. Next question. If I have to have a CT scan, I need to get undressed, and this would make me feel uncomfortable. Ooh, a little bit of a majority of red. So that was false, that was red. The scan is quick and painless, and you'll be fully clothed. We may ask you to remove your coat and any jewellery. And sometimes that does mean an underwired bra. You can also bring a friend or family to your appointment if that would make you feel more comfortable. There is plenty of room in that scanner. Not for them to get in the scanner, just in the unit. Next question. Lung cancer is a punishment or a death sentence? This is nice to see, guys. Lovely. That is false. Lung cancer is a physical disease, and it is not your fault. Screening finds lung cancer early when they are more treatable. What we usually say at these talks is that lung cancer, or any cancer, doesn't discriminate. So anyone can catch it, get it. I think that might be it.
It is.
Well done, guys. Thank you. Hand over to Chris.
Thank you, guys. One final comment from me. So I hope you got something out today. So I just want to ask you, please, to complete the survey for today. Either take the QR code on your phone and complete it, or there's paper copies under your seats. Use that. Anything you want to say about this event, we'd really appreciate it.
If you maybe want to learn about future cancers, stuff like that, put that there as well. But yeah, thank you.
Yeah, no, what is
What are you closing out?
Okay, just wanted to say that if you need to speak to our wonderful people from CELCA, one-on-one discussions, they are here. If you need more information as to how to access the service, they are here as well. So just let us know and we can arrange everyone accordingly. Yeah. So, do we have more questions? Who has the question?
We would like to sit down.
Oh, okay, no problem.
Sit down or lay down?
In a minute. Yeah. Anyone with questions? Okay. So we're running our tests now. Today we need to complete our examination. You know, we need to know what you've learned from today's workshop. We have the forms that we placed on your seats. If you could help us complete them. We also have QR codes to access the evaluation forms as well. Before you leave, you want to say
Oh, Mama, here to listen.
If you've completed the forms, please let us know. We will collect them from you. And we are done for today. If you need to see our CELCA team, just sit down where you are. We will come to meet you. I want to pass the mic to our program, one of our program doctors, Dr. Charlotte. She has some things to say to everyone. There you go.
Right, hi everybody. Thank you for coming. Did you learn something today? Yes. Great. Can anybody shout out something that they've learned? One thing. Yes. That is true. You don't have to be a smoker to potentially get lung cancer. Oh, yeah, that is true too. I've got two mics. But the lung cancer program here, this is targeted, as we already know, to smokers who have smoked over 100 cigarettes, as they've said earlier. But obviously, if you do have symptoms, and I will ask, actually, if you know what those symptoms are, to see your GP. So what were the symptoms that we talked about earlier?
Coughing.
Cough for how long? 3 weeks. Okay. Anything else? Oh, yeah. We talked about the clubbing. That's a bit of a technical thing, but if you do see that your nail is a bit more swollen, shortness of breath. Yes, persistent shortness of breath. 3 weeks, 6 weeks or so. That is not going away. You might want to come and see your GP. Hoarse voice for 3 weeks. So a number of these symptoms. And I think what's really important is that actually today's focus is really talking about lung cancer and for smokers. But we know that not all of us are smokers and not all of us have ever been smokers. But I'm sure we all know people who have smoked before, who is in that age bracket. And like Dr. Chichi said earlier, we are messengers. And if you know somebody dear and close to you and who have been invited or they might be invited in the future, you can sow that seed and actually encourage them to attend. I do also know that currently the uptake of the program isn't at its best, okay? So we can actually do something for our community, for our loved ones around us to actually increase this uptake. After all, it's free. It's free for use. One of the things that NHS is doing that is offering to people that is free. And so if you know someone, do please encourage them to uptake. So I would say anyone else with a question? If not, we will close. I just wanted to thank you for coming once again to our talk today. We have many more coming up in the coming months, and I do hope that you'll be able to come, invite your friends, neighbors, family. We'd like to see as many people being able to hear the messages as much as possible. And afterwards, if you wanted, there's some more questions and you wanted to ask Selka or ourselves, do stay behind. We can have a little chat with you. Okay, thank you.
Thank you very much. So if you need to pick up your vouchers, please make your way to the resource center. It's to your left. If you need to have your blood pressure taken, also that will be done at the resource center. If you need to have a chat with Selka, please remain seated. We will come to you. Thank you. See you on the 16th of April. That's the next workshop day.
Thank you, too.